Vinny, I played with Sid.
Lives like she is.
It'll be a real scorcher today, 95 in the shade, and tomorrow looks a little bit better.
Taking your calls right now at Hot 800 on the dial. With Mexican favorites so hot, it'll make your mouth and your eyes water.
It's hot out here. I certainly hope these doctors are cool with the idea of my stopping by to detail them on Skelaxin.
It'll be a real scorcher today, 95 in the shade, and tomorrow will be just about the same.
But what really burns me up? Dealing with all the questions about Flexeril and Soma.
It's hot in Hastings, humid in Union, scorching in Scarsdale, and tomorrow promises much of the same throughout your entire territory. Hi, my name is Barbara Percalis, and things are really heating up in the marketplace. Let's take a look at the current market conditions.
Ooh, I want to hear this.
The overall competitive climate remains unchanged, with Flexeril leading with nearly half of total prescriptions, Soma with about 1/3 of the share, and Skelaxin over 15% of the market. But there's stormy weather ahead. The aggressive launch of Flexeril's new 5 milligram dose seems to be building serious momentum. And just beyond that, high pressure is starting to develop over much of the sales region. This could explain all the instability in the air, and things are going to get even hotter.
Thank goodness.
We've stepped up our promotional and educational support for Skelaxin 800 considerably, with a new campaign to grow market share, at the expense of Flexeril and Soma. This CD-ROM focuses on the key selling portion of the call, the presentation, in which the visual aid is your primary selling tool. The goal of your sales presentation should be to conclude with the physician's commitment to make Skelaxin an integral part of his or her practice. These commitments happen more often when we make a well-planned sales presentation containing all the key elements that make a campaign successful. Use an interesting opening. Differentiate your product. Use the feature, advantage, benefit format, and ask for the business. Now let's see how a King representative introduces this idea during the opening of a call.
Hi, Doctor. Tiana Lucas with King Pharmaceuticals. Nice to meet you.
Hi, please have a seat.
Thank you.
So, what can we do for you today?
Doctor, I would like to take a couple minutes of your time to talk about those patients coming into your office who are experiencing low back pain, muscle strains, and sprains, and just how quickly they resume their normal activities.
All right.
I'm talking about someone like this patient, a typical patient between the ages of 26 and 50, taking medication for a back disorder or even a neck sprain. The only problem is he's taking Flexeril. Dr. Jones, are your patients getting tired of their muscle relaxants?
Our representative now wants to establish the need for minimum sedation in the mind of the physician. We know that physicians are very concerned about excessive sedation and drowsiness experienced with muscle relaxants, as well as their addictive properties. Therefore, we need to continually remind doctors that with Skelaxin, they can help their patients ease the pain and resume their normal activities quickly.
Doctor, we're finding that a lot of patients are coming into their doctor's office and are worried about sedation, and as a result, more doctors are turning to medications with lower sedating effects.
Yes, sedation has always been an issue with muscle relaxants.
Next, our rep begins selling Skelaxin by differentiating it from other muscle relaxant products. Remember to remind the physician, in addition to minimizing sedation, other benefits are also important. The new message we will be delivering is that Skelaxin provides fast pain relief that won't slow patients down. Once you differentiate Skelaxin from its competitors, it's important that you show physicians what's in it for the patient. This is the clinical benefit, and frankly, it's what's most important in the end.
Dr. Jones, Skelaxin is fast pain relief that won't slow your patients down. In fact, 2 separate, double-blind, placebo-controlled studies confirm the effectiveness and safety of using Skelaxin in your practice. As you see here, outpatients with acute low back syndrome or exacerbation of low back disorders responded dramatically to Skelaxin, with 89% and 84% success. Only 9 of the 91 patients experienced any side effects, compared with 3 patients treated with placebo. Skelaxin not only delivers minimal sedation, but also brings prompt relief of acute painful spasms and rapid improvement in mobility to your patients, often within 48 hours. And it has an onset of action of under an hour, which means Skelaxin's getting right to work and your patients are going to get quick relief. Peak plasma levels are reached within 2 hours, and it clears quickly by having a plasma half-life of only 2 to 3 hours. Dr. Jones, compared to other muscle relaxants, Skelaxin doesn't interfere with the motor activity involved in maintaining balance and posture, and it has a low incidence of CNS effects and drowsiness. Not only that, but Skelaxin is non-narcotic and non-addicting, with no risk of dependence, no withdrawal symptoms, and no adverse cardiovascular effects. You may have noticed that Flexeril recently cut their dose in half because drowsiness side effects were such an issue.
I recall hearing something about this at the annual meeting a few weeks back.
Fortunately, Skelaxin didn't have to compromise in any way. One 800 milligram Skelaxin tablet, TID or QID, can bring relief to muscle regions affected by pain and discomfort and help your patients gain range of motion.
It is more important than ever to promote therapeutic dosing, which leads to compliance and effective treatment. So make sure you stress the one tablet convenience of Skelaxin 800 milligram tablets.
And Dr. Jones, with a one tablet dosing convenience of Skelaxin 800 milligrams, TID or QID, helping patients achieve successful outcomes has never been easier. Plus, Skelaxin 800 milligrams is now available in a convenient scored tablet, so it provides you with dosing flexibility.
In closing the call, the rep summarizes the Skelaxin message, including some important fair balance, shows how to prescribe Skelaxin, and then asks for the business.
So, Dr. Jones, Skelaxin has certainly been proven with a successful 40-plus year track record. And what I would really simply ask as far as the next several musculoskeletal pain patients who come in is that you give Skelaxin an opportunity for those patients where indicated. Skelaxin is indicated as an adjunct to rest, physical therapy, and other measures for the relief of discomforts associated with acute, painful musculoskeletal conditions.
Are there any special precautions I need to be concerned with?
Doctor, you want to keep in mind that liver function tests should be performed in patients with pre-existing liver damage. The most common side effects are nausea, vomiting, GI upset, drowsiness, dizziness, headache, nervousness, or irritability. Dr. Jones, the way to prescribe Skelaxin is straightforward. As you see on the sample prescription pad here, you're going to write Skelaxin 800 milligrams, one tablet 3 to 4 times a day. So, Dr. Jones, based on what we've discussed, would you agree Skelaxin can make it easier to provide fast pain relief without slowing your patients down?
Sure.
So, doctor, for those patients who are experiencing muscle pain where sedation is a concern, would you prescribe Skelaxin?
Yes. Yes, I would.
Thank you very much.
You're welcome.
You're not always going to have the luxury of having time for a sit-down presentation. Frequently, you have to make a stand-up 1 or 2 minute presentation. For those times when you cannot use the full detail aid, you now have a Slim Jim, an alternate for abbreviated sales calls or impromptu meetings with your physicians. The new Slim Jim will reinforce our message and identify patient profiles, ensuring its long-term usefulness. It will support the graphics and copy of the new campaign. Let's look at how our rep handles a hallway sales call using one of these pieces.
Dr. Bixley, Tiana Lucas with King Pharmaceuticals. Nice to see you.
Nice to see you. I've got about 1 minute.
I just wanted to follow up with you in regards to our last call when we discussed treating patients with sprains, such as those involving the talofibular ligament. I want to point out that patients like this one often get tired from their muscle relaxants, but they can get fast pain relief that won't slow them down with Skelaxin 800 mg tablets. Compared to other muscle relaxants, Skelaxin doesn't interfere with the motor activity involved in maintaining balance and posture, and it has a low incidence of CNS effects and drowsiness. Not only will it provide prompt relief and a rapid improvement in mobility, but Skelaxin is non-narcotic, non-addicting, and doesn't interact with MAOIs.
How does that compare with Flexeril?
While there's been no head-to-head safety study comparing the two, Flexeril recently cut their dose in half because drowsiness side effects were such an issue. Fortunately, Skelaxin didn't have to compromise in any way.
That's impressive.
Doctor, with a one-tablet 800 mg convenience of Skelaxin behind your patients, helping them achieve successful outcomes is easier than ever. In terms of prescribing Skelaxin for the next patient that it is indicated for, and based on what we've discussed, would you prescribe Skelaxin?
Sure. Do you have any samples?
I do, and I'd be happy to leave some with you. If you'd please just give me a signature.
Okay.
Thank you so much. Bye.
My pleasure.
Remember, whenever you sell Skelaxin, whether it's in the office or in the hallway, we need to make sure that our two key messages are the ones that are being communicated to the doctors. First, to promote therapeutic dosing, which leads to patient compliance and effective treatment. Second, we need to capitalize on the low drowsiness aspect of Skelaxin, which is superior to Flexeril and Soma, including the new 5 mg tablet, and continue to compete for the non-sedating patient. Over the next few months, we will shower you with additional sales tools, including new programs and samples for your called-on physicians, new direct mail and journal advertising to your non-called-on physicians, ad boards, CME and speaker programs at conventions, even a pharmacy push to help drive the new 800 mg message, so you can take on the heat. Whenever these tools are used with or as part of an effective presentation, you can focus doctors' attention on the advantages of Skelaxin 800 mg. Now you're ready to take on the heat from Flexeril 5 mg with the tools and support you need to fuel your selling efforts and handle objections more effectively. Good luck and good selling.
Let's turn it on.